Okay. In this session, we will discuss about medulla oblongata. As you know, human brain is located in the cranial fossa, anterior, middle, and posterior cranial fossae. And human brain has many parts. The most largest part that is related to the thinking, judgment, personality, and decision making is called cerebral hemispheres. In each cerebral hemisphere, there are structures around the third ventricle that these structures make diencephalon. Diencephalon is composed of thalamus, hypothalamus, subthalamus, metathalamus, and epithalamus. There are three parts of the brain that are related to the human being and continuation of the life. There are many centers in this area that are related to the continuation of the life, such as circulatory system center, breathing or respiratory system center, and damage of these three parts of the brain is equal to the death. Okay? These three parts are called brain stem. Totally, these three parts make brain stem. Brain stem is composed of midbrain, pons, and medulla oblongata. Okay? These three parts make brain stem. Medulla oblongata has 3 centimeter length. Pons has 2.5 centimeter length, and midbrain has 2 centimeter length. Medulla oblongata is the longest part, and midbrain is the shortest part. And there are many nuclei and many centers in the brainstem that are related to the continuation of the life. Okay? In some cases, maybe you remove a part of the cerebral hemisphere. Okay? After one trauma, you should remove a part of the cerebral hemisphere. There are many changes in the mood, in the behavior, in the decision making, in the judgment of that patient after removing a part of the brain. But he or she can stay, can live. Is it clear?
Yes.
But when brainstem has damage, it's very dangerous. Okay?
Okay.
Tell me about this patient. A 49-year-old woman experiences sudden onset of a headache with nausea and vertigo. Nausea, it means
Feeling or vomiting, but exactly not.
تهوع. Yeah? Vertigo means dizziness, vertigo. In the Farsi we tell sargije. Sargije. Okay? Nausea, حالت تهوع, vertigo, sargije. Headache, sardar. Yeah. She has difficulty keeping her balance and finds that she falls on the left. Okay? When she's standing up, falls on the left side. Is it clear?
Yes.
On physical examination, she has decreased muscle tone in the left arm, left upper extremity, and left lower extremity. Okay? Muscle tone decrease on the left side. Also, muscle mass is normal. There is some intention tremor associated with movements of left arm. What's the tremor?
Small shaking?
Yeah, small shaking, tremor. There are two types of tremor. Rest tremor and intention tremor. Rest tremor, for example, in the Parkinson's disease, there is rest tremor. When your patient standing and you don't tell any function, any activation for him or her, your patient has shaking. Yeah? Asymmetrical shaking of hands. This is rest tremor. Okay? But in intention tremor, in the normal condition, there isn't any shaking, any tremor. But when you tell, please close your bottom, okay? In this condition, he or she has tremor. This is intention tremor. Okay?
Okay.
Intention tremor is related to the cerebellum. And rest tremor is related to the basal nuclei. Okay? Okay?
Okay.
In this patient, which part of the brain has damage?
Is the right side.
Is right side?
Left side.
Which part of the brain has damage?
Yeah.
Is it unilateral or bilateral?
Unilateral.
If it's unilateral, in which side?
Left side.
Right side.
Right side.
Right side or left side?
Right side.
And which artery is most likely involved in this syndrome?
It's cerebellum artery. Cerebellum artery.
Which one? Which cerebral artery? Okay. We should find answers of these questions in this session. Okay?
Okay.
I told you, brain stem is composed of medulla oblongata, pons, and midbrain. It connects the brain to the spinal cord. Medulla oblongata is a conical structure, an inferior part of the brain. Inferior part of the
Brain.
brain is medulla oblongata. An American scientist, McLean, told human brain has 3 parts. Human brain has 3 parts. A part that is related to the continuation of the life is called reptilian brain. Reptilia means
It's something with scales, an animal with scales. Cold-blooded.
Ability to replicate.
It's renewable.
reptilia,
It's about reptile.
reptile, yeah.
Which part of the
Reptile, such as crocodile,
yeah.
Yeah.
yeah,
Nice.
snail, crocodile, and turtle. Yeah, these are reptilians. Reptilian brain is composed of brainstem and cerebellum. Brainstem and cerebellum. Medulla oblongata, pons, midbrain, and cerebellum are related to the continuation of the life. Second part of the brain is called the visceral brain. It's related to the emotions. Limbic system is visceral brain. And second part of the brain is related to the thinking and decision making and judgment and personality and controlling their emotions. This is new brain or neo brain that is composed of cerebral hemispheres. Okay?
Okay.
Medulla oblongata is the inferior part of the brain that inferiorly attached to the spinal cord, and superiorly is related to the pons. It's related to the
Pons.
pons. It has 3 centimeter length, and superior part has large diameter in comparison to the inferior part. Between pons and medulla oblongata, there is a sulcus that is called the pontomedullary sulcus. Pontomedullary sulcus. From pontomedullary sulcus, 3 pairs of cranial nerves emerge. Abducens or cranial nerve number 6, facial or cranial nerve number 7, and vestibulocochlear, cranial nerve number 8. Okay? 3 pairs of cranial nerves emerge from the pontomedullary sulcus. An inferior part of the medulla oblongata attached to the spinal cord. And superior to this attachment, you see pyramidal decussation. Pyramidal decussation. I will tell about this decussation. pyramidal decussation. Medulla oblongata has 4 surfaces, similar to the spinal cord. Anterior surface, posterior surface, and 2 lateral surfaces. On the midline of the anterior surface, there is a fissure that is called anterior median fissure, similar to anterior median fissure of the spinal cord. Anterior median fissure. Okay? This fissure is anterior median fissure. And in the inferior part of the anterior median fissure, there is pyramidal decussation. Pyramidal decussation that interrupt lower part here, and in the anterior surface of the medulla oblongata, at the junction of pontomedullary sulcus and anterior median fissure here, there is a foramen that is called foramen secum. Foramen secum. Here. On the superior part of the anterior surface of the medulla oblongata, on each side, here and here, this elevation, this prominence is called pyramis or pyramid. Pyramis or pyramid. Under this pyramid or pyramids, there is pyramidal tract or corticospinal tract. Another name of the corticospinal tract is pyramidal tract. Okay, here is pyramis or pyramid. And under pyramis or pyramid, there is pyramidal tract. Okay? On each side of the anterior surface, between anterior surface and lateral surface, there is anterolateral sulcus, similar to the spinal cord. Yeah? Anterolateral sulcus. And from anterolateral sulcus, hypoglossal nerve or cranial nerve number 12 emerges. Okay? This nerve is hypoglossal nerve that emerges from anterolateral sulcus of the medulla oblongata. This is pyramid or pyramis, and here is anterolateral sulcus, and this nerve is hypoglossal nerve. On the upper part of the lateral surface, upper part of the lateral surface of the medulla oblongata, there is an elevation that is called olive. Olive. Zaytun. Yeah? Olive. Under olive, there is inferior olivary complex. Inferior olivary complex. On the anterior surface, on each side, there is pyramid or pyramis. Yeah? Pyramid or pyramis. And on the lateral surface, there is olive. And under olive, there is inferior olivary complex of nuclei. I will tell. Under pyramid, there is corticospinal tract or pyramidal tract. Okay? Here is pyramid. Here is anterior median fissure. Here is anterolateral sulcus. And this nerve is hypoglossal nerve. This is pontomedullary sulcus. And this nerve is abducens. This is facial and this is vestibulocochlear nerve. Okay?
Okay.
At the junction of anterior median fissure and pontomedullary sulcus, this foramen is foramen secum. These are pyramids or pyramids. Posterior surface of the medulla oblongata has two parts. Posterior surface of the medulla oblongata has two parts. Inferior closed part and superior open part. Inferior
Close part.
closed part and superior open part. Inferior closed part is similar to the posterior surface of the cervical spinal cord. Similar to the posterior surface of the cervical spinal cord. It has posterior median sulcus in the midline and posterolateral sulci on each side. Okay? Between posterolateral sulcus on each side and posterior median sulcus, there is posterior intermediate sulcus. Posterior intermediate sulcus. Here is fasciculus gracilis. Fasciculus gracilis. And here is fasciculus conatus, similar to the posterior surface of the cervical spinal cord. Your name is Jafar.
Yes.
Yeah. Your name is Hassanin.
Yes.
How are you, Hassanin?
Not very good.
Why?
I'm the same. Sleepy.
Why?
I'm not used to staying up to this time.
It's not important.
No, it's very important.
I keep waking up. I don't let myself sleep.
Go wash your face and come. Posterior surface of the closed part of the medulla oblongata is similar to the posterior surface of the cervical spinal cord. It has posterior median sulcus, posterolateral sulci, and between posterolateral sulcus and posterior median sulcus on each side, there is posterior intermediate sulcus. This is fasciculus gracilis, continuation of fasciculus gracilis in the spinal cord, and this is fasciculus conatus, continuation of fasciculus conatus in the spinal cord. On the superior part of the fasciculus gracilis, here, there is an elevation that is called gracilis tubercle. Gracilis tubercle. Under gracilis tubercle, there is gracilis nucleus. And on the superior part of the fasciculus conatus, there is an elevation that is called conatus tubercle, and under tubercle there is conatus nucleus. Okay?
Okay.
Which part?
This part, the last part.
The last part is which part?
Tubercle.
Conatus.
Because someone confused a lot of things.
I will ask from him. Okay? Okay. I told you posterior surface of the closed part of the medulla oblongata is similar to the
Cervical.
cervical spinal cord. It has one median, posterior median sulcus
Posterior lateral sulcus.
and two posterolateral sulci.
And posterior.
And between posterolateral sulcus and median sulcus, there is posterior intermediate sulcus on each side.
Yes.
Okay? And similar to spinal cord in the cervical part, there is fasciculus gracilis and fasciculus conatus. Superior to the fasciculus gracilis, there is a tubercle that is called gracilis tubercle. And under gracilis tubercle, there is gracilis nucleus. Okay? And on the superior part of the fasciculus conatus, there is conatus tubercle. Under conatus tubercle, there is conatus nucleus. Okay? Gracilis nucleus makes gracilis tubercle. And conatus nucleus makes conatus tubercle. Is it clear?
Yes.
Open part of the posterior surface of the medulla oblongata is a part of the floor of the fourth ventricle. In the human brain, there are four ventricles. There are four
Ventricle.
ventricles. Two lateral ventricles in the cerebral hemispheres. Okay?
Okay.
One ventricle in the diencephalon that is called third ventricle. And one ventricle on the posterior aspect of the pons and superior part of the medulla, this diamond-shaped ventricle that is called fourth ventricle. Fourth ventricle. On the floor of the fourth ventricle, there is a sulcus on the midline that is called median sulcus. Do you imagine? This is fourth ventricle. This is floor of the fourth ventricle. Okay?
Okay.
In the midline, on the floor of the fourth ventricle, there is a sulcus. Here is a sulcus. That this sulcus is called median sulcus. Is it clear?
Yes.
On each side of the median sulcus, there is an elevation, and there is another sulcus, that this sulcus is called sulcus limitans. Sulcus
Limita.
limitans. This is sulcus limitans here. Okay? On the superior part of the sulcus limitans, on the superior part of the sulcus limitus here, in the pons, there is a nucleus that is called locus ceruleus. Locus ceruleus. This nucleus is related to the attention. Is related to the
Attention.
attention. Okay?
Okay.
There are many other parts in the brain for attention, such as anterior cingulate, medial prefrontal. Okay? But this nucleus is a part of attention circuit. It's related to the attention. Yeah. This is locus ceruleus on the superior part of the sulcus limitus. Lateral to the sulcus limitus, this triangular area is called vestibular area. And in the vestibular area, there are 4 vestibular nuclei: superior vestibular nucleus, lateral vestibular nucleus, medial vestibular nucleus, and inferior vestibular nucleus. There are 4 vestibular nuclei. If you remember, I told you vestibulospinal tract is located on the anterior part of anterior funiculus. Yes?
Yes.
And function of this tract is contraction of extensor muscles and inhibition of flexor muscles, opposite to the corticospinal and rubrospinal tract. Do you remember?
Yes.
Yeah? If you remember, I told you vestibulospinal tract doesn't have any crossing, and origin of this tract is from lateral vestibular nucleus. From lateral vestibular nucleus. Is it clear? Okay?
Okay.
From lateral vestibular nucleus, without any crossing, descending fibers intern to the anterior funiculus. And function of vestibulospinal tract is contraction of extensor muscles and inhibition of flexor muscles, opposite to the rubrospinal and corticospinal tracts. Yeah?
Yes.
Between median sulcus and sulcus limitus on each side, there is an elevation that is called, this area is called medial eminence. Medial eminence. Okay? On the floor of the fourth ventricle, there are many transverse fibers that these fibers from median sulcus go to the lateral part. These transverse fibers are called stria medullaris. These fibers are called stria medullaris. Stria medullaris.
Which part will consist medial eminence? Which part from the inferior?
Which part?
Yes.
Which part?
Will consist the medial eminence.
Medial eminence is here. Here.
Okay.
Between sulcus
Between-
limitus and median
in this space?
sulcus. This part.
Ah.
Completely is called medial eminence. Between median sulcus and sulcus limitus. Okay? There are many transverse fibers that are called stria medullaris, and stria medullaris divide floor of the fourth ventricle to two parts. Superior part is related to the posterior surface of the pons, and inferior part is related to the posterior surface of the medulla oblongata. Is it clear?
Yes.
Yeah?
Yes.
Here is medulla oblongata and here is pons. Okay?
Okay.
On the medial eminence, in this superior part that is related to the pons, there is an elevation on each side. That this elevation is called facial colliculus. Facial colliculus. Facial colliculus in the pons is formed by motor fibers of the facial nerve. Motor fibers of the
Facial nerve.
facial
Nerve.
nerve that turn around the abducens nucleus. Motor fibers of the facial nerve that turn around the abducens nucleus make facial colliculus. But in the posterior part of the medulla oblongata, medial eminence on each side has two triangles. Has two triangles. This triangle, this one is called hypoglossal triangle. Hypoglossal triangle. And under hypoglossal triangle there is hypoglossal nucleus. In the hypoglossal triangle, the base of triangle is superior and apex of triangle is inferior.
Inferior.
And this triangle, that its base is superior and its apex is superior and base is inferior, is called vagal triangle. Vagal
Triangle.
triangle. Under vagal triangle, there is a dorsal nucleus of the vagus. Dorsal nucleus of the
Vagus.
vagus. Okay?
Okay.
Dorsal nucleus of the
Vagus.
vagus is here. Is it clear?
Yes.
Okay? You see here, this is facial colliculus. This is sulcus limitus. Yeah? This is vestibular area. Here is stria medullaris. This triangle is hypoglossal triangle, and this triangle is vagal triangle. Okay?
Okay.
Under hypoglossal triangle, there is hypoglossal nucleus. And under vagal triangle, there is dorsal nucleus of the vagus. Okay?
Okay.
Here is floor of the fourth ventricle. Roof of the fourth ventricle is composed of superior medullary velum and inferior medullary velum. Here is superior medullary velum. And here is inferior medullary velum. Okay?
Okay.
Superior medullary velum is formed by one layer of ependymal cells and one layer of pia mater. And inferior medullary velum is formed by one layer of ependymal cells and two layers of pia mater. Why? Here is two layers. Why? Here is fourth ventricle. Yeah? Here is fourth ventricle. This is superior part, posterior surface of the bones, and here is superior medullary velum. And this part is inferior medullary velum. Okay? Superior medullary velum is formed by one layer of pia mater and one layer of ependymal cells. But inferior medullary velum is formed by one layer of ependymal cells and two layers of pia mater. Why?
One
Why?
from the brain and one from the spinal
For
cord.
the
Location of the brain stem is optic. Yeah? And cerebellum is located posterior to the medulla oblongata and the pons. You see here? Yeah? Weight of the cerebellum make attachment between pia mater of the cerebellum and pia mater of the inferior medullary velum. Okay? One layer of pia mater is related to the fourth ventricle and one layer is related to the inferior surface of the cerebellum. Is it clear?
Yes.
Yeah? On the inferior medullary velum, there are three foramina. Three foramina. One foramen on the midline inferior part that is called foramen of Majandi. Foramen of
Agenda.
Majandi. One single foramen in the inferior part of the inferior medullary velum that is called foramen of Majandi. And two foramina, superior and lateral, that these foramina are called foramina of Lushka. Foramina of
Loshka.
Lushka. What's the function of this foramina, Hassan?
Function?
Where is location of foramina?
The location is in the median aperture.
Foramen of Majandi is inferior in the midline, and foramina of Lushka superior and lateral. Okay?
Okay.
The function of this foramina is drainage of cerebrospinal fluid from fourth ventricle into the subarachnoid space. Okay? From fourth ventricle to the subarachnoid space. Cerebrospinal fluid drains from fourth ventricle to the subarachnoid space. Okay? You see here, gracilis tubercle, conatus tubercle, hypoglottal triangle, vagal triangle, and stria medullaris. This is floor of the fourth ventricle, and in this picture you see olive on the lateral surface of the medulla oblongata. I told you, hypoglossal nerve emerges from anterolateral sulcus of the medulla oblongata. Yeah? Glossopharyngeal, vagus, and accessory nerves emerge from posterolateral sulcus of the medulla oblongata. Okay? 4 pairs of cranial nerves emerge from medulla oblongata. Hypoglossal nerve from anterolateral sulcus, glossopharyngeal, vagus, and accessory nerves from posterolateral sulcus. Is it clear? Yeah?
Yes.
Okay. Do you need rest?
Yes.
Yes. After 10 minutes,